Okay, we get the message that the recording is in progress. Good morning. Welcome to everybody on the webinar of the Rotarian Action Group for Addiction Prevention with the support of WFED, Dianova International and UNODC. We are happy to get you all together, and we want, next slide please, we want to present some parts of the work of the Rotarian Action Group. You will find the flyer here presented in the chat, so you can read that easily yourself. I will not go into details. I just want to tell you, next slide please, that the Rotarian Action Group has two important points of cooperation, especially here for the C&D session. We cooperate with countries. So for country delegates, it's important to know that the Rotarian Action Group Addiction Prevention can help countries translate their national vision and policies into concrete actions by prospecting the support of Rotary clubs and districts in the country concerned. So we can mobilize energy and money from Rotary clubs to support your implementation of programs. Also important for the NGOs, and the Rotarian Action Group Addiction Prevention also cooperates with NGOs, whereby the local branches of the NGO are helped to roll out their evidence-based prevention programs with the support of the local Rotary clubs. So we join local chapters of your NGO with Rotary clubs to support your action and to finance your action. We can discuss later how it goes and how we can help you. Today, we are going to have a look at programs with an accent for families. And this is a special accent for the Rotarian Action Group because we have a cooperation with UNODC, the prevention unit, and especially with a focus on in implementing where we are a partner in a prevention project. We always integrate projects for families and prevention for family. So you will hear that from the speakers coming up. Next slide, please. These are the presentations of the panel members. And so the first speakers will speak about the prevention project for families in Spain. The second speaker will speak about prevention project with young people in Uganda. And then we will have an overview of a cooperation project between a city, Rotary, and professional NGOs. And the last speaker is Wadi Malouf from United Nations Office itself, Treatment and Rehabilitation Section. And he will make some conclusions about our cooperation. So here I give the word to Lucia and Antonio.
Thank you very much. Good morning, everybody. So my name is Lucia Huerna, and I'm from DiaNova International. I would really like to thank you for giving us the opportunity to showcasing actually a universal prevention program for families that DiaNova is implementing, that's currently implementing in Spain. So just to start with some words about the organization, we are based in 19 countries and we work in the social sanitary domain. We have more than 35 years of experience in the prevention and addiction of prevention and treatment of addictions. So the situation of youth in Spain is a bit complicated. There are high youth unemployment rates. There is a rise of discontent among young people. The effects of COVID in mental health rest to be seen in young people, but it's been proved that the effects of COVID in addictive behaviors, there is a link, particularly when it comes to gambling and gaming. And when it comes to the consumption of substances, Spain has unfortunately a very early age of initial consumption of alcohol, tobacco, and cannabis, and there is a high prevalence of binge drinking among young people. So this all put together highlights the importance of working in prevention. And in Spain, what we have observed is that most prevention is conducted in educational settings, so that with this project, we wanted to contribute to closing the gap in the prevention programs at the family level. So the programs, the problems we want to tackle and we want to face is the consumption pattern among young people in Spain, but also together with addictions without substances, we've seen increasing uses of compulsive use of social networks, gaming, gambling, and also the interaction between risky behaviors such as disobedience, impulsivity, or violent or sexual risky behaviors among young with addictive behaviors. So that's why we came up with this universal prevention program for families. It's targeted for fathers or mothers or tutors of children aged between 8 and 16 years old. And it is to prevent the causes and consequences of inappropriate use of alcohol, tobacco, including e-cigarettes, cannabis, also technologies and risky behaviors. So given the sanitary situation, we've firstly come up with the idea of doing online training sessions. In total, there would be 6 sessions or of 1.5 minutes each. And the interesting and differential aspects is that the sessions are conducted in very small groups. It's up to maximum 20 people, and they're interactive. They're conducted by a professional in the field of addictions, actually Antonio Molina, who will speak right after me. And this is the first goal is this pilot project. It's for 100 families. We started in January and are expecting to get the 100 families by the end of the first semester. As it was said, like the initial idea, we're conducting this in Spain, but the aim is that once the pilot has been evaluated, that we can escalate it at the international level. And regarding the relation between DiaNova and RAC-IP, we signed a memorandum of understanding in 2020. And RAC-IP have been very supportive from the early stages of this project design. They have funded the project evaluation chapter, which is a very important one for the pilot project. And they're also helping us give it visibility to the project, like also by events such like as this one, but also to liaise with Spanish Rotarians, so with the local chapters in Spain. And also the idea, as I said, it would be after this to replicate it internationally, and for that Rotary counts with a very strong network. As for the funding itself for the program, we have foreseen that participants do a small contribution of 20%, because this is a way of engaging people with the training. And also there is a contribution from RAC-IP for 20%. And then the rest of the funding, we're seeking it directly from local Rotary clubs in Spain. And the funding, it's important also to say that it's channeled through the Humanitarian Foundation of Spanish Rotarians. So now I would like to give the floor to Antonio Molina to continue the presentation. Thank you.
Thank you very much, Lucia. Thank you very much for the Rotary Action Group for giving us, and also for UNODC for giving us the chance to present the work that we are doing in the Together We Grow program. These are the contents of the program. We have split the program in 6 different modules. The first one is about education for health, with information about different addictive behaviors, not only substances, but also talking about new psychoactive substances, about gambling, about gaming, and about the need and the special role of the family as family agent. The second one is about the adolescence and how we define the actual role of adolescence and the actual risk of adolescence. So we have adapted and we have analyzed several materials trying to give to generate an actual social context for the adolescent situation right now in Spain, and it can be adapted for other social contexts. The third module is about training the prevention and detection of risk factors. We have used for sure the risk and protection factors model. So we are not talking about anything that you don't know previously. The fourth one is about action plans and in the prevention and protective factors, how to develop action plans much more based in different aspects and factors like the family support, like social support, like leisure time, more than in social or health factors. And the fifth and sixth modules are talking about skills and abilities and competencies, basically communication competencies, negotiation competencies, mediation competencies, and for sure emotional competencies for families, because we have detected that are the highly demanded skills that family needs, and we consider that it's necessary to give a specific training for families about these topics and skills. Next slide, please, Lucia. Thank you. So as framework, we have used the Rotary Action Group Addictive Prevention Toolkit. That is a very useful tool that I think that Raccoon Martins is going to explain later. So I'm not going to talk it with detail, but it's a very specific tool to detect the different indicators and criteria of evaluation for prevention programs. We are doing, because we are now in the process of evaluation. We are doing a combination of qualitative and quantitative methodology. We are making, we want to make an analysis of less 100 surveys. We are now making the collection of the groups. So we are in the moment of data collecting. We are using the process and results indicators that is going to be about what we are going to do is to collect the information, to make an analysis of quantitative and qualitative data. What we want to do is not only to make an evaluation of the program, of the beginning of the program. What we want to do is how to evaluate and to monitor the Together We Grow program. So we don't want only to make an initial assessment or to make an evidence-based program from Together We Grow. What we want to do is to conduct a data-driven program in which we can continuously collect data to make decisions about what is working in the program, what we have to modify from the program, or what we have to improve in the program, because we have that models and we have that models with the contents of the models specifically developed, but we want to know if that contents are going to work in 1 year, 2 years, 3 years, and it's going to be useful for the people in other social contexts. So we want not only to make the evaluation of the initial pilot of the program, we want to include a monitor of Together We Grow program. So for making, we are using several evaluation tools, quantitative and qualitative evaluation tools. Quantitative data, because we want to have a general idea and to contrast information about what it works and what is not, and qualitative data because we want to go deeper and to detect what can we improve in the program and what is the perception and the satisfaction of the people about the program. So we are using a pre-post assessment with a sample selected ex post. So it's an almost experimental, quasi-experimental design. We are using a questionnaire for the pre-post that is based in the positive parental scale, because what we want to know is what skills had the families participant in the program before the program, what skills have improved their families by participation in the program. We have got also an in-depth questionnaire about the specific pillars of the program, about, for example, the participation of the community coalition, about how we improve the role of family as health agents, about what is the level of satisfaction and perception of feasibility of the program, and as I said before, as to the efficacy and efficiency of the community coalition of the program. So we want to make a design or not only about the data of the program. We want to make the design, the implementation, and the social impact of Together We Grow program. For example, the evaluation of the design has been done now because we have done the first groups of the participants, and we know that what we are making seems to be what we have to make. Now we want to know if the implementation of what we have done is the proper way to improve the skills and the capacities for the families, depending on the prevention of addictive programs, of addictive behaviors. Next slide, please. So we have done a traditional process of participative action process. There is a matrix of evaluation with the aims of the program, criteria of evaluation, and the task related with any kind of aspects. And we have structured this process of evaluation in the 4 parts. One, to assess the skills of the families, the previous skills and the post skills after the program, the role of the family, to evaluate the level of satisfaction and the perception of the programs, of the families, about if the program is valid or not, or what part of the program they consider that are more valid, what parts of the program they consider that need to be improved, what part of the program need to be deleted or erased, because sometimes we have to make decisions about the programs, and if the program is not working, that there are some modules or contents of the program that are not working, we have to make decisions about what it works and what is not. And the 4th part is about the own development of the program, the participation of the community coalition, the participation of the agents in the program, the participation, the media and the social media and the communication task of the program, to include them in all the process of evaluation of the program. Yeah. So we have found that there are some positive aspects for the experience for us. For example, the partnership with the Rotarian Action Group is incredible, and the use of the toolkit has been very, very useful, and the support that we have received and we are continuously receiving from the local Rotary clubs has been very important. Other part is the evaluation of the design. Sometimes we think that what we have done is the proper thing or is the right one, but we need to check it. It's not easy, but it's a very not difficult process, and it's important to detect that what you have done can be useful for the people that you suppose that you have done that contents and that materials. So the first step that we have done is evaluation of the design, evaluation of the coalition. The coalition is covering their aims and the needs of the whole project, and the participation of every member of the coalition has been successful for all the stakeholders. That is very important. And what are the needs of information that all the stakeholders have got? Maybe there are stakeholders that only need information about the beginning and the end of the project, but there are another stakeholders that want to be involved during the whole process. So for us, it's very important. The version of implementation, that is what we are doing now. We are now collecting the surveys, we are making the sessions. So when we will have at least initial data, we will present as soon as possible in these forums or in similar. For sure, we will try to make it in scientific forums. The role of family as health agent, that we think is a thing that needs to be improved and recovered, because for a long time it was very, very important for the prevention of addictive behaviors. Then there are other kind of prevention perspectives that have been improved, and now when we consider that it's necessary to recover this perspective of the family as health agent. Every kind of family can be a health agent, so we need to improve their skills and capacities for detect, for prevention, and for early intervention if it's necessary in addictive behaviors. And the perspective of health promotion education and health education, that we think that is very important. Is health promotion much more than trying to talk about the risky behavior. We want to talk about how to improve quality of lives and patterns of behavior. There are challenging aspects that we have to improve. Is the long process of request funding from local Rotary clubs. It's necessary to improve the sustainability of the project, and the interest of the topic, that, as we know, when we talk about the role of the family as a prevention agent, now it's in a secondary position, depending on other kind of problems like the COVID has been last 2 years, and now we have this impact of the war in our tasks and activities. So we need to accept and we need to improve the visibility of our program. Thank you very much. Lucia, if you want to tell something.
No, it's all from my side. Thank you.
Thank you very much. Honored.
Thank you, Antonio. Questions and answers, you can put in the question and answers, so we will come back on that later. We go for our next speaker. Anna, for you, the floor, please, or the screen. Yeah.
Yes, thank you, Johan. Lucia, kindly help with the sharing the PowerPoint presentation. Thank you very much. Thank you everyone for joining in this morning. Good morning to you all. My name is Anna Navulia. I work with Uganda Youth Development Link, and I'll be sharing some of our work with families and parents in creating a safe environment for young people that is free from alcohol and drugs, but also abuse in general, where we specifically look at sexual reproductive health and also sexual abuse and exploitation of children within the ages of 15 to 25 years. Next slide, please. So briefly, this is what Uganda Youth Development Link does. We are now 28 years in existence. We are a non-government organization working within Kampala, Wakiso, but largely within Uganda. We do a lot of socioeconomic rehabilitation and reintegration and empowerment of young people. And then we also target more of the urban slum young people that are within the different key slum areas within Kampala and also other capital cities within Kampala. Our areas of focus are mainly alcohol, drugs, and substance abuse, commercial sexual exploitation of children, child trafficking, child labor, but we also work with sexual reproductive health, and we also do social research. So just to get back into the topic for today, which is the role of families. Next slide, please. We basically use these 3 key interventions to work with families and parents, and also with the young people that come through our drop-in centers. And the main, these 3 interventions have to do with the Prevention Smart Parents program, which I'm very sure that some of you may be familiar with. We also use Synovio, which is a better parenting family intervention. And then we also use the strengthening of community coalitions model as well to work with young people. Please continue. Now, just to get into each of the modules, I'll basically talk about the Prevention Smart Parents, which is basically an intervention that was developed by Mentor UK, and it was aimed at educating parents and families about drugs and their dangers, because we realized that in Uganda, we had many parents who were not even aware that some of the young people were abusing drugs, or didn't even know what drugs were, or even couldn't detect it. So we felt this model was very good for us to educate parents about drugs and their dangers, but also to help the young people themselves understand why the abuse of drugs is dangerous, but also to help parents to start talking to their children about drugs and alcohol, which was quite a taboo, or it's something that is a taboo in most of our African settings. And it's not easy for parents to start these discussions, especially with their teenage or emerging adults, teenagers. And then it was also a step to help parents to start, to start talking to their children or take action with children who are already experimenting with drugs. But basically it aims at creating a healthy environment where children and parents can work together and be involved in dealing with issues or handling issues of alcohol and drugs. Next slide, please. So the other intervention or module that we use is called Synovio. Synovio is a Swahili word, which means happy families. It's basically a better parenting family intervention that we have used with adolescent girls and young women in urban rural areas, but also in the in the urban slum areas where we are actively running drop-in centers. It is basically a participatory approach which involves the parent, the caregiver, and also the child or the children in that particular household. And it takes basically 14 weeks. And they are basically exploring the abilities on how they can critically look at some of those social norms and values that they hold dear that sometimes may create a negative impact or may impact on their attitudes and behavior. So we are basically looking at their personal, psychological, and social aspects that can help them, analyze their attitudes, but also their perceptions and behaviors as a family. Next slide, please. So Synovio, which is basically helping families get along together. It has a few guiding principles where the parents and the young people have to work together to solve problems within their household. It also involves them setting up some house rules and clear instructions on what they would want to achieve or where they want to go. It also helps them to have alternative means for discipline, but also to understand that sometimes there may be consequences for somebody breaking the house rules or not abiding by the instructions that they have set up together as a family and the children themselves. It also helps them, provide a safe space where families can start talking about different aspects. In African settings, we see a lot of sexuality being a taboo for parents to talk about with their children. So this gives them a safe space where they can talk about issues of sexuality, alcohol, drugs, and substance abuse, but also other aspects like finances within the family. They can also look at the safety, but also other conflicts that may come as a result of the environmental issues that may be happening around them. But it also has an element where it encourages support and also praises, which are very good for building a positive relationship between a child and their caregivers or their families. Next slide, please. So these are the numbers of the young people that have gone through this session since 2016 with their families. So the number that you see there comes with either a mother, a father, their brothers, or their caretakers, and they're all involved in this session. So these are the sessions that we've handled so far since 2016. And like you can see, 2020, 2021, because of COVID, we had to reduce on these aspects because they are done in groups of 20. And we couldn't, due to the lockdown, we couldn't have group sessions going on. So we reduced on the number of sessions or interventions that we're doing with Synovio. Next slide, please. These are some of the achievements we've had with the Synovio program, which is the Better Parenting program. We've seen a lot of increased parenting skills because this was one of the gaps that we had identified, that some of the parents did not have adequate parenting skills, given that some of them are even children themselves that have given birth to children. So there are children who are parenting children with limited parenting skills. So we've seen parenting skills improve. We've seen confidence of the parents improve. We've seen positive parenting behaviors. We are known in Uganda, but also Africa at large, to use more of the cane and punish and beat children. But we now see more proactive means of discipline and more positive parenting behavior. We no longer see parents barking at children or chasing them away or disowning them from their homes. We see them now taking a more proactive step in dealing with the issues, especially around alcohol and drugs, crime, but also sexual abuse within the family and gender-based violence. We've also seen reduced cases in alcohol abuse. We've actually seen a positive relationship being built within the caregivers and also the children themselves. We've had a lot of families that have put up rules and routines that are, comfortable to them and comfortable to everyone within the homestead because they sit together and agree on these different aspects. Next slide, please. These are some of the photos that are showing some of the Synovio sessions with the young people and their families. Next slide, please. Again, here we are just showcasing how some of these sessions are handled. You'll see one of the families just down there. Again, all the children within the homestead coming together with their parents and the key caregivers. It could be a house help, it could be anyone who stays with them, an uncle and auntie, they all join within these sessions and come up with a positive parenting schedule and a positive parenting plan. Next slide, please. So the third intervention we use is the strengthening of community coalitions. And this one brings in the family, but we also recognize that there are other community members out there because in Africa, a family is not just your father and mother, but anyone who contributes to building you or molding you. It could be a local leader, it could be a business person, it could be a media, it could be another fellow young person, it could be a religious leader. So we see all those as a family. So this model is basically looking at that other wider family that is not just closed within your mother and father and brothers and sisters. And we've piloted this in 2 different divisions within Kampala. One is in Nansana and the other one is in Waise. And these have been basically trained virtually and face-to-face trainings by Kadika, with the aim of having a drug demand reduction efforts that are targeting different communities. Next slide, please. So these are the memberships of the 2 coalitions that have been set up. Next slide, please. I'll showcase, in a few minutes, I'll be showing you some of the achievements of this model. We have seen these coalitions collect data on drugs and alcohol within their different communities and parishes using different, they have used this data to influence policy change within their different localities. And it goes to as low as a small village. So we are seeing those local small village coming up with bylaws. They are talking to the authorities about different issues that are affecting them, or different aspects of alcohol and drugs that are affecting them within their community. And we are seeing that the division officials and authorities are taking up some of these issues that they raise within their data collection, and are using them in their planning for the populations in the 2 communities where we've had it. We've also seen a lot of engagements with the local video hall owners, because this is one of the areas where we have seen many young people starting to abuse drugs and alcohol. And these video owners have actually developed codes of supported the ban of smoking and also drinking alcohol within their premises, but they've also tried to reduce on the numbers of children or that are below the age of 18 that access these premises than it was before. But we've also seen some of these local leaders supporting the bylaws that have been developed. We've seen some bars that are stopping buying and that are stopping children from buying and selling drugs within their facilities, and that there are penalties that are given to the parents or to the caregivers that allow their children to access these premises, but also go and buy these things. And then we've also seen quite an increased engagement with the local leadership in monitoring of the homes, but also stopping some of these families in engaging in local home alcohol productions in especially one of the communities in Waise. Next slide, please. We've seen communities engaging in different sessions for cleanup. They've actually taken on other community responsive activities like cleanups and sensitizing their own peers, sensitizing the communities about garbage, but also about drugs and alcohol. We've seen some of the young people now starting to join proactive activities like sports and music, dance and drama. We have seen the communities starting to identify young people who need even more help and support, especially where they may need employable skills, because we are seeing that sometimes some of these trends are due to the lack of skills or the lack of, the demand in the market, and they can't meet that. So these coalitions have helped with that as well. Next slide, please. So these are some of the other extracurricular activities that have been done by these groups within the communities as a result of the community coalition model. And in case you need any additional information, you can find us on the links there and on the website there. Thank you for listening. Thank you, Rotary Action Group, for having us here and for allowing us to showcase the work that Uganda Youth Development Link does in Uganda. Thank you so much.
Thank you, Anna. We go from Uganda to Belgium. In Belgium, we have a program with, in cooperation with Rotary Club Maldegem. This is also the club where I am a member. And this club is already working 25 years on addiction prevention. And started to get organized in the cooperation with the city of Maldegem. Raccoon will give an overview of the program and then also about the toolkit for measuring social impact, which is integrated in the program. Raccoon, for you the floor and the screen.
Okay, thank you everyone. And I'll try to be a little bit quicker so that we have time for Q&A at the end. I'll try to stick within my 5 minutes, but very nice to meet you all. I work for the scientific committee at the Rotarian Action Group. And I'm also affiliated to the University of Cambridge. So yes, two parts of this presentation. The first one will be all about the project we're doing in Belgium, and then the second one on the toolkits. So we, in Maldegem, a city in Belgium, we have a project committee, which is a cooperation between schools, the municipality, parents, youth organizations, and sports organizations. Next slide, please. So back in 1995 till 2015, we done a couple of projects that were mainly between the Rotary Club in Maldegem and some professional NGOs, but nothing was formalized. There was no official agreement or cooperation, or there was no big plan. So we decided to set up a charter to collaborate with the city of Maldegem and the schools that explains how we would implement a whole range of projects and addiction prevention programs. And then we moved into a second charter with even more partners, youth, sports, and parents organizations. But I'll get back to that in a second. Next slide, please. Yes. Okay, so this is just a photo of the charter and when the first charter was signed, this first collaboration agreement. Next, please. So the first charter involved 14 primary schools, 3 secondary schools, and in total about 3,700 pupils were involved or hopefully positively affected by the program. Next. Okay, so in this first collaboration agreement, the first charter, we did an evaluation survey to see how well it worked and what the results were. In general, the primary school programs are very well implemented and they are still being used even after the charter expired. Teachers, however, reported that there was a lack of involvement in the choice of programs. Training-wise, the initial training was okay, but then there were no follow-up trainings or top-ups. So sometimes you need to boost someone's performance, but the trainings were not always done. The follow-up trainings were not always done. For nursery schools, they didn't really work with the program that was chosen in the charter, so that didn't really work. Secondary schools, in the charter, it was written that they would continue with previously successful programs, but they didn't have neither. And then the survey that we sent to the teacher for the first grade secondary schools, it was not completed, so we don't have info on that. Next, please. So we took a couple of conclusions to work towards a second charter. So first of all, for organizations, we told for everyone involved in the charter, instead of postulating that they use a certain program, we leave the choice open for organizations to choose a program. But also we do note that the first step should always be to develop a policy for alcohol, drug, internet screen use, so specific to, for example, the school or the organization. And then in the second step, there should be a free choice of a good data-driven prevention program based on those policy priorities. And this time we should really have good training for teachers, youth, sports leaders, and parents, and with follow-ups every year and a permanent or continuous evaluation. Next, please. Okay, so for the second charter, we had a budget of about 10,000 euros, 50% by the Rotary Club and 50% by the city. So the partners this time included a broader coalition, schools, youth, sports, and parents organizations. And really the goals per organization should now be that policy, that data-driven program, continuous evaluation, and then as extra support from Reg IP, we provide extra training, follow-up, and an extra support. But also the charter includes that we will help to cover 2/3 of all the costs, but only if the impact is measured. And this is a very important thing, and that's where I can link it to the toolkit that we've developed to measure that impact. So here we go. This is the second part of the presentation, the RAC-IP impact toolkit. So this is where we got together with the scientific committee and analyzed. We saw that both Rotary and loads of other international organizations do loads of huge projects that are really good. Sometimes a lot of us involved, but we don't always really know what the positive and negative impacts are. So we, next please. So we really wanted to design something that looks at the impacts on the individual level, the family level, and the community level. And a toolkit that people could use bottom up for their projects whenever they design a project. And when I talk about individuals, I also mean within different groups, such as different genders, different education status, but also different types of families and different types of communities, rural, urban, and so on. So we really have to look at all these positive and negative aspects of the interventions we do. Next. Okay, so another finding was that a lot of these collaborations use so-called evidence-based programs. But what is that? So often if you look into it, some programs have not really been recently evaluated, or they were tested in a different target group. For example, in the 1970s in the United States, and then we implemented in India in 2022, which is sometimes problematic. Often long-term analysis are missing. The impact measurement framework is based on methodologies from many years ago. So we really need to have up-to-date methodologies, and they do not always look at every level, because you have to distinguish between that individual, family, and community level. Also, just as important as mapping the positive effects, we need to always really focus on finding the negative effects and specifically looking for it as well. And then finally, we found that there's often a lack of availability of the data. It is not that difficult per se to create an anonymous data set and publish it for transparency, but it's often not really available. So how can we really gauge the impact, and how can we really know that we get the value for the money and energy that we invest in it? Okay, so we thought like, okay, the end goal, but we're not there yet, is we would ideally be able for RAC-IP at least, and for all the projects we work in, have a label depending on the impact on the community and the quality of the evidence. Next. But more importantly, we started with a toolkit that everyone could use, every Rotarian and every partner. And that's also something that was nicely presented in the presentation by Dianova. Thank you, Lucia and Antonio, for the good presentation on that. So basically, we just developed this handbook. You can have a look at it. The link is in there. We can also post it in the chat after or discuss it. But in a nutshell, next. We have a couple of steps. We explain how to set up a project committee that has a wide range of sectors in society. Next. We explain the importance of doing a proper needs assessment and goal setting. Next. And with that, an impact measurement plan, which includes long-term evaluation and all those different levels. And then indeed how to implement the project and actually execute it. And then finally, the continuous evaluation. So yeah, you can have a look and we can discuss all about that if you're working on these things. There's also this interaction between RAC-IP and the project level. So we leave the project in all autonomy on how to do the evidence evaluation, but we provide the support from RAC-IP level, the toolkit, and do an extra quality control on it if wanted. So yeah, so here we have it, an impact toolkit. It's still in development. It's an interactive process. Every new project, we keep changing it, but in general, it's data-driven, comprehensive community assessment. Latest science should be implemented. The evidence quality label is a first step towards it is taken. And we try to link it to the Rotary areas of focus, but also UN SDGs, which have a large overlap. And then we have impact reports and data availability that we're working on, and hopefully we can put all of that in public. Okay. So that's it. You can go to the next slide. Okay, so thank you. If you have any questions, feel free to reach out. But also today, as Johan posted in the chat, for those who are present in person, we're going to have a lunch in the UN cafeteria at 12. So hopefully to see you there. All right, thank you all.
Thank you, Raccoon. This is a clear overview. Let's go and let's listen what UNODC and Wadi can tell us. And that's also relevant for our cooperation as one of the examples. Because of our cooperation, we integrated the work with families in the charter with the city of Maldegem. The screen is for you, Wadid.
Thank you very much, Johan. I hope you're seeing the right screen in terms of presentation. Excellent. It is a pleasure and an honor to join this great event, to hear these wonderful sound bites in terms of like what is being done in the field. And on behalf of UNODC, we're grateful for Rotary Club to actually pitch that slot to discuss this very important topic for us that we've been focusing on for a long period of time. And personally, I've been involved in for the last 11 years really with UNODC. And I will show you just a bit of, my presentation will be more of a story than anything else in order to kind of move with the rhetoric forward. My slides are not moving, but I'm doing my best. So I don't know what to do. Yeah. So these are the essential starting point where we start with working with prevention. Is focusing on the culture that we want to preach with regards to the prevention standards. These are important sound bites for everybody working in prevention that we would like to focus on. That really will put in context of the relevance of all the work that's been done before and was presented by Dionova from UDEL and from RAG. There's a science behind prevention, and that is the main message, that the prevention standards that we have per WHO standards of evidence in the context of COVID-19, you can appreciate how much that rigorousness of evidence is tough to reach. But there is a lot of prevention that is based on science there that need to be put in place and prioritized over improvisation of prevention intervention, relying on science. But most importantly, the science tells us that prevention goes beyond just raising awareness about drugs. It's much deeper than that. Prevention of drug use reflect the fact that it is not a personally free choice where just saying no campaigns can help a person overcome that vulnerability that is linked to that risky behavior. And I will talk about it, a bit more details about it. But one of the most essential messages is most of the evidence that is in these standards reflect the fact that the packages that are effective focus on the intellectual, the language, the cognitive, and the social competency skills that a person needs at different ages of development, and in many cases do not discuss drugs at all. And that's where the evidence is, and that's where we're pushing policymakers and service providers and grassroots organizations to move. To tell the general focus is, policymakers, you're interested in drugs, service providers, community, you're like, your stress is the drug. But when it comes to prevention, your point of focus is not the drug. The point of focus is the person, and how can you help that person move forward? So this is the vulnerability matrix that we really focus on when it comes to prevention. In reality, this is the story of that child that at the individual level has some genetic traits, have a mental health characteristics, has a certain reactivity to stress, has a certain neurological development. That child at the individual level lives within microstructures that supports them. The family, the school, the peers. And these microstructures function in a good way sometimes, function in a bad way sometimes, and do not function sometimes, right? And that interaction with these, between that individual and these microstructure is a key driver that either sort of attenuate that vulnerability that exists at the personal level or amplifies it. But even these microstructures exist in a larger macro environment. A family raising their child in displacement, in refugees, in war zones, or in social deprivation is different than raising your child in a normal sort of resource well-developed city. So the microenvironment carries an impact on the microenvironment, and the microenvironment also carry a direct impact on the individual themselves. So you really want to accompany that child in different ages of development. You want that the story of that child that has a reactivity to stress with the dissociated parents, that poor access to school in a displaced environment is a story of thousands and millions of other children at the community level. That should be your point of focus. And imagine in that context, you're only arming that child with information about drugs and messages of just say no. That child needs more to overcome these vulnerabilities. And these vulnerabilities are not unique to drug prevention. These are the same vulnerabilities that are linked with violence, that are linked with mental health issues, that are linked with violence against children, that are linked with crime, and linked with many other sort of risky behaviors and negative and social health outcome that the child could face. And this is precisely why the formula of the prevention standard really reflect a change of vision that these milestones of development and assistance of social and emotional learning packages can start as early as when the child is in utero, in the womb of the mother. And this is a revelation for policymakers. And there are messages that, that are there in terms of a program of effectiveness that really reflect that. But it is in that rhetoric and that story that I mentioned, even though that there is not enough evidence of packages that are really gender sensitive in the sense of, is that same program equally effective for boys and girls? The situation, the science is evolving in this. But we know for a fact, from an etiological perspective, that girls and boys develop in a different trajectory with age. And also, women and girls have different way of interacting with the environment than boys and men. And that's why it's very important to reflect the fact of what packages are useful for development. If we're thinking from a developmental perspective for boys and girls, that gender sensitivity is key in terms of development. And this is one of the areas of why we're focusing a lot on families as UNODC, because family is one of those social institutions when armed with a proper functioning perspective from a social and emotional learning perspective, it really has evidence that it affects both boys and girls. But that's an essential thing when other package, because the family cannot solve all the problem, when any other prevention intervention need to be put in place is an important thing to focus. We are currently living in unprecedented times. COVID-19, I talked about these vulnerabilities, that thinking process before. COVID-19 came in as an added component of vulnerability. For caregivers and for children. Children are, these are unprecedented times for them when, they're dissociated from school, they're dissociated from their friends, schools are closed, distant learning, parents are working from home, and social economic pressures over and beyond the virus itself, and losing the bereavement that they're facing with losing family members, as well as family members that are sick. All of these have created a situation of new vulnerabilities where mental health has risen a lot in the caregivers and their children. Violence against children have been on the rise. And this is, Antonio Monina was talking about this also previously. This is a thing that, really required member states, required service providers to engage more than ever because of that new need. Wherever, instead of this, unfortunately, quick economic recovery measures have taken priority and precedence, and investment in prevention has been reduced. Further to the COVID-19 context, the context of crisis situation, displacement, refugees is unfortunately even rising more and more in numbers. And caregiving under these circumstances is completely more challenging. Parents used to function, these are families that used to function in a normal way, and suddenly are thrown in a context where it is very difficult for them to do caregiving. And this is where we have worked a lot also in terms of assisting these families in these circumstances. Most recently, we have developed these interagency tools that are supporting even families in Ukraine, but also we have worked in Afghanistan, in the Middle East and North Africa and beyond, because these are new challenges for children that need that assistance more than before. We have several tools that have been put in place, and we really support these open source programs that are free to use. One of them is Strong Family, a package that is for families living in stressful situations that also has been piloted in over 40 countries. Family United is one that is universal, but is designed for low and middle income countries. Really, just this echo what we've previously done before, these family skills packages are key now more than ever. But also individually, life and social skills packages are also of support over and beyond. So you build the resilience of the child and the functioning within the family. So there are open source packages that exist, including in schools, or we're also supporting, as you know, through the sports settings, these packages. A context that is similar to UDEL that has been mentioned in the sense of youth empowerment, that community empowerment, the youth initiative that UNODC sort of provides is a forum where youth start talking with each other at the grassroots level, really to kind of mediate these evidence-based programs. And the science, through basic messages, we have the Listen First campaign supporting you. So I'm just laying out these packages that are free, that UNODC have developed, that further supports the good work done in place, that really echoes the message that you're working on. And hopefully we get the chance to work together in order to support this healthy and safe development of youth moving forward. Because this change of paradigm, the work that you've been doing is key, but there are two things that need to be done. The research that's done on the ground, which is key to demonstrate that these things work, but there's a lot of work that needs to be done top down in terms of engaging with the policymakers at the high level, theory, to change that culture of what works in the field of drug prevention. And that's why I really applaud you for having this side event talking about this specific topic during CND when policymakers are here discussing in terms of how to move forward programming wise. Now, all the tools that I mentioned are, I have small flyers that hopefully with the organizer will allow to learn more about them. But I end by just thanking you for this opportunity, hoping to have time for question and answer. Over back to you, Johan.
Thank you, Wadi. Of course, we take some time for questions and answers. Thank you for your clear explanation. We will discuss later on which of the programs we will be using in the new projects coming up, but Line Up for Sports looks a very interesting program that we can use immediately. So time for question and answers. I see that most questions has been answered written. So please raise your hand if you have another question and we will try to answer your question. Who is the first? Do you see, Lucia, do you see the hands raising, or can I see that on my screen?
No. As it is a webinar mode, questions should be written in the chat.
Ah, okay, so no hands to raise. So please write your question in the chat and we come back on it immediately. I see a question from Larry. Wadi, can we get copy of these insights or the slides you mean? We will provide a copy of all presentations to all participants. Also with a link of the recording, so everybody will have every presentation. And then I have no open questions anymore. So as it's already also time, I think it's the moment to close the session. I don't see any questions coming up. So then reminding you, we are, I see, no, it's a thank in the chat, thank you. We are here in person in Vienna. For people who are present in Vienna in person, we can meet at 12 in the C building if you have time for it. If not, we can arrange another meeting one of the days coming. And if you're not in the building, if not in person, you can make contact and we try to set up a Zoom meeting or a Teams meeting to see how we can help you in addiction prevention. So I see one question. Thank you, Wadi. Could you also avail platforms to learn about the Life Up and how to access training? Can you answer that question, Wadi?
I will send my my contacts. I mean, my contacts are in the presentation. So whoever is interested, feel free to contact me in this presentation because it might take time to kind of describe the process. but I'm available for any question on a bilateral basis to kind of explain more details what is needed on any of the programs that are mentioned, including lineup revamp.
Yeah, okay. We will also provide the email addresses of all speakers so that you can get directly in touch with them when needed. Voila. Okay, then Lucia, we can close the session and hope to see you back because this is not the last webinar we will organize. This is the one at the occasion of the side event at the 65th CND session, but we will have regular meetings and we'll invite you all for the next webinar. Thank you.
Thank you.